Welcome to our final segment in which we summarize the key learning points of the module. First, I'd like to wrap up by returning to the story of Martin Bromley.
We have a breakdown of leadership, of situational awareness, of prioritization, of decision making, of communication, and of assertiveness. And these same factors, these same human factors, ironically, are present in 75% of aviation accidents. And really, since then, I've been trying to understand why in aviation we train and to understand about human factors, and it's an integral part of how we design equipment and how we manage procedures and how we work day to day. It's part of our everyday language, but I'm trying to understand why that's not part of clinical practice. It's an opening up of communication. Human factors tells us that actually we're all wrong no matter how good we are, and we need people around us to help us. It's creating that open environment within your colleagues, being open to suggestions. If they put their hand up and say, "Excuse me, I'm not sure about this," it's not turning around and saying, "Actually, I'm the boss here." It's turning around and saying, "Tell me what your concern is." It's listening.
There were many challenges at play in this story. To summarize this module, let's consider how leaders and members might overcome some of these. First, leaders can foster collaboration by fostering the principles of team-based care: shared goals, clear roles, mutual trust, effective communication, and measurable processes and outcomes. Leaders must also build and support a collaborative culture by being inclusive and creating psychological safety. There are many leadership typologies. The leadership compass is just one of them. Whichever one resonates with you, it's important to self-reflect on your style and how it affects your interaction with others. And just as there are leadership styles, there are also distinct approaches to being a team member. Effective team membership involves constructive critical thinking and active engagement. Let's recap the strategies and tools covered in this module. Situational awareness is the ability to maintain an awareness of the big picture and respond in a timely manner. Inquiry and advocacy is a tool that helps foster mutual understanding and bridge different viewpoints. And finally, good team leaders and members know how to seek out and use feedback. Start by discussing things the receiver is doing well and should keep doing, then discuss things that the receiver should start to do to improve performance, and then address behaviors that should be stopped. I would like to give thanks to Martin Bromley for granting us permission to use the video Just a Routine Operation, which was developed by the NHS Institute. For additional resources, please go to www.chfg.org. And finally, I would like to acknowledge the wonderful work of colleagues who contributed to this module, who are listed here, as well as the many other colleagues at this institution and beyond who gave us valuable feedback as well. Thank you.